Do you know that according to the Canadian Urological Association, approximately 1 in 10 Canadians will develop a kidney stone once in their lifetime? Kidney stone is a health issue that is becoming more and more prevalent in modern society. Kidney stones are not actual stones in your kidneys, but they are instead tiny crystals that form in various locations in your excretory system, including your pelvis or calyxes of the kidneys or the ureter. As we all already know, the role of the excretory system is to remove waste products from our bodies in the form of pee. Kidney stones form when your pee is too concentrated and when there is too little water, which causes minerals in your pee to crystallize and clump. When kidney stones first start to form, they are harmless, as they are too small to be noticed. However, with more of the free-floating chemicals in your pee joining up and clumping together, the kidney stone would grow larger. Eventually, when the kidney stone grows and exceeds the size of 5 millimeters, which usually takes several months, it starts to cause some problems, such as blocking the flow of pee and scratching the lining of the urinary tract, which would evolve into further problems. For example, if you feel severe pain in your back that will not go away, or find blood in your pee, those could be symptoms of hard and sharp kidney stones damaging your excretory system. In addition, some less obvious symptoms of kidney stones include chills and fevers, which are symptoms of a kidney infection that could be caused by the presence of kidney stones in your ureter, blocking waste products from passing through it and causing a buildup of bacteria and ultimately leading to a kidney infection. Some other symptoms of kidney stones include nausea and vomiting. This is because stones in your kidneys can trigger nerves in the digestive tract, which could upset the stomach. If multiple symptoms above apply to you, it is highly recommended for you to go visit a doctor. When visiting a doctor, tell the doctor your symptoms, and the doctor will perform diagnostic tests such as blood testing, urine testing, or imaging, which I will now go over each of them in more detail. In a blood test, the doctor would take a sample of your blood and analyze its components. If it is discovered that you have high levels of uric acid and certain minerals in your blood, such as calcium and magnesium, that can lead to the formation of kidney stones, it could be a hint for the presence of kidney stones. Alternatively, the urine test can also hint at the presence of kidney stones. If the test shows that you're excreting too much kidney stone-forming minerals or too less kidney stone-preventing substances. If tests above show positive results, the doctor could then perform a CT scan on you to check for kidney stones in your urinary tract. It is also important to note that abdominal x-rays are not efficient imaging tests because they can easily miss tiny kidney stones. If kidney stones are found in your body, do not panic. Just remember that 10% of Canadians face the same problem as you do. If the kidney stones in your body are small in size, they may be excreted without any treatments. However, if they are larger, a procedure known as shockwave lithotripsy may be performed, in which the doctor would use a machine called a lithotripter to generate a series of shockwaves targeting a kidney stone to break it into smaller pieces that would be able to pass through your urinary tract. But if the stone is larger at over 7 millimeters in size, surgery may be necessary to remove the stone. Data suggests that about 30 to 50% of people who have had a kidney stone will have another within 5 years. Although the statistics may seem scary, getting a kidney stone is not purely by chance, but it is preventable with a healthy diet. One of the best practices to avoid kidney stones is to drink plenty of water, about 2 to 3 liters a day. This can help dilute urine so that crystals don't clump into stones. It is also worth noting that 80% of all kidney stones are calcium oxalate. Thus, one should also limit their intake on oxalate as much as possible. On the contrary, it is surprisingly not a good idea to reduce the intake of calcium, even though it ironically is a part of the stone. This is due to that eating calcium would allow for them to bind with the oxalate in the intestines, which reduces the amount of oxalate that can be absorbed into the bloodstream. So if you have kidney stones, you know what to do. Thanks for watching.